promoting a good idea, and that's the collection and disposal of unused, outdated prescription drugs that we find in our medicine cabinets at home, drugs that we've gotten for decent purposes, for honorable purposes, and their life has run out. We haven't used them, and you might not understand or realize just how significant a problem that's been in our society. People actually go in other people's homes and look in their medicine cabinets, not just out of curiosity, but to see what they can pick up in the way of drugs and medications, and then there's the accompanying chaos that follows that in our community. And so thanks to the health department and our law enforcement community, we're able to promote a new service to our community where all of these unused, outdated, no longer required prescription drugs can be collected and then disposed of safely to the benefit of our community. Just a few comments I'll make before I turn it over to Mr. Culver, who's actually going to talk about how the collection process will work and how they'll be disposed. Nationwide, law enforcement officials have seen an increase in the abuse of prescription drugs because of their relatively easy accessibility. The abuse of prescription drugs is of great concern in Wicomico County, as it is all over our country. Narcotics and other prescription medicines are being taken out of family members' and friends' medicine cabinets without their knowledge. The prescription drug disposal program will give residents and visitors 4 convenient sites to dispose of unused, unwanted, or outdated medications that are all too frequently falling into the wrong hands and being abused. Funding for the drop boxes was provided by the Wicomico County Health Department through the Alcohol Drug Abuse Administration, the Recovery-Oriented Systems of Care Prevention Services. The drug drop box program was initially launched by the National Association of Drug Diversion Investigators and was designed to significantly reduce the amount of prescription drugs in the homes that are no longer needed or are outdated. We want expired and unused medications to be disposed of in a safe manner to deter home invasions and related crime. We're going to have 4 permanent locations for these drop boxes. Now, again, I say this is not a new idea. We've had drug collection opportunities in the past, but they've been in passing for a particular event where we've had a place for people to come up. These will be 4 permanent locations that people will have access to throughout the year. We'll have a drop box at the Wicomico County Sheriff's Office Monday through Friday from 8 a.m. to 5 p.m. At the Fruitland Police Department from Monday through Friday, 8 to 4 p.m. At the Delmar Police Department Monday through Friday, 8 a.m. to 5 p.m. And at the Salisbury Police Department Monday through Sunday, 24 hours a day. We are very excited that Wicomico County can now be a part of a collaborative effort to improve the safety of our community and the health of our environment. And so now I'd like to turn it over to Mr. Culver, who will tell you about how all of this comes together and what happens to these nasty drugs after they're out of our hands. Mr. Culver, if you would.
Thank you, sir. You all should have a flyer that was passed out by the health department. And on the flyer it shows a green box that talks about disposal of medication safely and anonymously with 24 hour or 8 hours a day or whatever the operation is. People will take their medications from home and drop them in the box. There's no paperwork to fill out. There's no fees to pay except to me. And on a regular basis, and we don't know at this time whether the one at the Salisbury Police Department, for example, will be picked up once a week or once a month, or at the Sheriff's Office once a month or once every 6 months. We just don't know. But my plan is to probably service them on a regular basis so that all of a sudden they don't overfill. We will remove the medications. We will put the medications in a large 25-gallon reusable container. When that container is full or near full, we'll put it on one of our trucks and take it to Curtis Bay Energy in Baltimore, where it is incinerated. It's gone, except the tub. We keep the tub. And again, depending upon the volume, the frequency, we will take the container. I'm very much involved with this program through some financial contributions that we want it to work. And I feel it will work if the people of Wicomico County or Somerset County or wherever they're from, if they want to bring them here and put them in the containers. tried to call Ocean City today to see how their program was working, and the gentleman in charge of it was in the building, but he didn't answer the page, so I don't know whether they've shipped anything or not. I don't think they have. But they also service their criminal investigation division with bloody items and things like that they may get during the investigations of some crime scenes. It will work. We're well versed in the rules and regulations and have a stellar safety record. No incidents, no problems with the DEA, and that. So we've been doing this now for over 25 years. We're not new boy on the block. A little plug for the company. We have 1,000 customers between Wilmington and Cape Charles and Kent Island to Ocean City. And next year, by this time, we should probably have 3,000 or 1,200, maybe 250. We did yesterday 7 new customers in the state of Delaware. All people calling us. So we're very busy, and we are very appreciative of the fact that we are very busy. If anybody has a question or a comment, I'll be more than happy to try to answer it at this time. I know I haven't covered all that well. But it's been a long time coming. The Sheriff's Department got to jump on it, and Ocean City's had to jump on it, but it's there. It'll work. It will work. And this means that the John Q. homeowner can get rid of their medications without throwing them in the trash and having them contaminate the landfill. That's it.
Okay.
Thank you.
Thanks, Mr. Calder. And we will be hanging around for a while afterwards. If anyone would have any questions they'd like to ask of us, just a little bit more information for you. According to the Maryland Poison Control, half of the 864 calls to poison control from Wicomico County in 2011 were about children under 6 years old. The most common exposures, according to Maryland Poison Control, the most common medicine exposures for children under 6 years old were pain relievers and medicines for skin. Also on the list are heart medicines, thyroid, anti-diabetic, and gastrointestinal medicines, as well as antihistamines and vitamins. On behalf of the Health Department, we're excited to be a part of this much-needed program to improve the health and safety of our community and the environment. Now, as I mentioned before, all of these folks here are doing their part to make these facilities available. It's not going to work unless our community takes advantage of this service. We urge all of our people in our community to go through your medicine cabinets, go through those pill boxes, and you don't necessarily have to be just in Wicomico County. If you're seeing this program, if you're hearing about the program, come to our 3 municipal police departments or come to our sheriff's department and get rid of those pills. We'll take them gladly. You'll make your community safer. You'll make your family safer. So thank you very much for attending.
I have 2 quick comments.
Yes, sir, Mr. Calder.
We get every other week a 25-gallon container of medications from Peninsula Regional Medical Center. They're either out of date or they don't want them